Kentucky ranks #1 in adult smokers in the whole United States. We have almost 900,000 adult smokers in our state, so we have a big job.
I see it sort of the domino effect of living in a state where the smoking rates are so highly prevalent. Some of our counties, rates are up 38, close to 40%. So when you think about it, for that one person trying to quit in a family or a community or a group of friends where everyone else smokes, that really poses a very unique challenge.
In everything that we're doing, we're trying to fold in tobacco cessation because quitting smoking will have a greater impact than maybe their chemotherapy or the radiation. We know how important that is.
For people with serious mental illness, smoking rates are disproportionately high.
Our numbers at the Quit Line, we have discovered that about 63% of all of our callers say yes to one type of mental illness or another. So that's huge. You have to address that. You have to get them services. We were delighted to be accepted into the tobacco control community of practice.
We applied to get some technical assistance from the network and went out to Denver and were a part of a really helpful training on doing strategic planning on how to reduce tobacco use in the mental health population.
I was invited to a group of about 40 professionals that were experts in cessation and mental health, insurance providers, and we all were pulled together to look at the disparity for cessation in the mental health population.
So having like a common initiative that we could say, I'm not just hypothetically asking you to be involved with my consortium. Here's an actual project that we could work on together, we could see from beginning to end.
And so just by pulling together, combining our resources, working as one team, we've been able to do significant things to help people quit and learn how to access their tobacco cessation benefits with their insurance providers. When you have the #1 adult smoking rate in the whole nation, you figure out very quickly that you're not going to get anywhere unless you bring as many partners to the table as possible. So we collaborate to make change.
I'm here to make our state healthier, and I think a lot of the partners that are successful in collaboration are the ones that are able to do that.
We want to have a healthier population, and in that regard, it makes financial sense for us to encourage quitting so that we have a healthier membership.
And so one of the things we decided to do was to try to make some sort of information sheet for folks to help them figure out what they could bill for and how to code it in regards to tobacco use.
Those codes are important because a lot of providers don't know the codes. And the reason why smoking cessation benefits aren't necessarily being provided because they don't know how to get paid for them.
Then the greatest thing ever happened, which Senate Bill 89 passed, and that means in Kentucky that you no longer hypothetically have to worry whether something's covered by an insurance company or not, that technically all FDA-approved nicotine replacement therapies should be covered by insurance companies. So now that we already had the relationship, thanks to that initiative, we can get those same people back at the table to figure out how to implement this Senate bill.
Oftentimes just getting people to engage in the quitting process can be a challenge. We're a tobacco culture here in Kentucky. We're a tobacco growing state. And so a big part of our culture has seen tobacco as a very positive thing for the economy of the state and for a lot of the individual farmers here in Kentucky. But it's shifting, the culture is shifting. Smoke-free initiatives have helped that. It's seen more as the norm, now not to smoke than the norm to smoke.
I've been a smoker since I was 30, and through this process I've actually been able to quit. So the more education you give people and the more opportunity and access you give them to treatment, the more likely you're going to be able to get them to quit.